my name is Shakira and I am here with Angela. She's going to be speaking a little bit about your pre-op and your post-op process during your surgical procedure. Hi Angela, how are you?
Hi Shakira.
Hi.
Good, thank you.
Good. Okay, I want you to explain to us, what do you do here? How much knowledge, how long have you been in this industry? And then we can go from there with our questions.
Well, I have been in the plastic surgery industry for about 4 years. I've worked with various doctors in the past, but plastic surgery, this is my 4th year, and so far it's been the best and I love it. I am in charge of basically making sure that the patient has everything in order before their surgery, whether it's their labs or EKGs, urine tests, any other tests that the doctor may order. Depending on the procedure, I also go over what they can expect during their surgery and even afterwards as well.
What are your most frequently asked questions from my patients?
I guess the most frequent question is, will I feel pain? But aside from that will be the post-op. What they can expect after the post-op, when they can return to work, when they can go to the gym, when they can drive, and how they're going to sleep.
Okay, so let's get a little bit more in depth there. For post-op, I know the first 24 hours, obviously, after each procedure is case by case on patients. You know, every patient's different. Everybody handles pain differently. But what do you recommend for the first 24 hours after you get any surgical procedure?
I think before and after the patient goes into surgery is hydrate. Hydration is key. It does not matter the procedure, atomic makeover, atomic side, lipo, BBL, breast augmentation. It's very important that the patient walks and moves their legs after to prevent any blood.
Every procedure works different, so we need different materials for after the procedure. So, for example, if I were to get a lipo 360, what should I expect myself to buy to be prepared for my post-op journey?
Okay, so the faja is very important. We provide the first stage faja here, which allows for you to, the patient, to put the foams in and the board. So it's a more elastic material fabric than the stage 2 or stage 3. And the reason why it's that way is because the patient swells up and they need some compression. That's very important. And so the first most important thing will be the right faja, then the foams, then the board.
Okay, so I know that any type of lymphatic massage is very helpful for after getting any type of lipo procedure. So either lipo 360, BBL. Can you explain a little bit about why it's so important and how it changes your post-op result within the near future?
Yes. So we encourage the patient to start with their lymphatic massages literally next day after those, because all the incisions are open and need to be drained. And by that I mean it not just blood, not just the bodily fluids, but also we use a solution called tumescent. It's a clear solution, and it is injected into the area that is being liposuction, and so all that needs to come out. So you not only drain through the incisions, but you also drain when you urinate, etc. But the lymphatic massages kind of speed that process and to getting those fluids out. It helps the patient to feel better, also reduces the swelling and the pain, and helps to shape the body.
Okay, so basically those massages are gonna help the patient feel 100 times better, less swollen, and it's gonna actually keep the actual result that they have right after surgery for a very long periods of time because the contours are way smoother.
Yes.
Okay.
So recommended that the patient begins their lymphatic drainage massages next day, and following day, every day to 10-15 times. And it's like having a car. You need to do a maintenance on. You do an oil change, you rotate the tires. It's kind of the same thing. So after you're done with the massages, you should do a tune-up to your body, maybe once a week, twice a month, however you're able to do it. But I feel like you should do it as long as you're able to do it.
especially the first year post-op, because if I'm not mistaken, your body can change tremendously. You know, within the first 3 months, within the first 6 months, but even 12 months post-op, your body is still changing from your procedure. So getting those massages actually help your body contour itself better, and that way, you know, you get what you pay for. It's not waste.
Everyone is different, but you can be swollen for an entire year. It can take 6 months to a full year for you to see the fun.
So now you know. You know, obviously, right after the procedure, you're gonna be able to notice a huge difference. But your final result, it's not gonna be completely noticeable in there up until 12 months post-op, okay?
So faja, massages, and that's it.
Those are your essentials for after surgery.